And I welcome the opportunity to speak on this particular piece of legislation. Minister, here in the House on the 9th of September, or 9th of November, the Taoiseach, in response to comments from my colleague, Deputy Padda Tobin, on the reconfiguration of Navan Hospital, suggested that Deputy Tobin would visit Roscommon Hospital, or the Taoiseach suggested that Deputy Tobin should visit Roscommon Hospital in terms of the expansion in the range of services there. I noticed the Taoiseach said it when I wasn't present in the House, because I think he might have a different approach if I was present. However, having said that, I want to see if the Taoiseach is prepared to live up to his words, and I hope that we can see some progress in relation to services. And yes, elective services have improved in Roscommon Hospital. The ambulance services haven't, and we have the scandal in relation to the fact that more services and more people could be treated in Roscommon Hospital if we haven't a deliberate blockage by the Celta Hospital Group not to provide the sterilisation facilities that are so urgently required in that hospital. Now, I have here in front of me a letter dated from the then Minister for Health of the 9th of October 2018 regarding the progression of the CSSD, the Central Sterile Services Department at Roscommon University Hospital. In fact, we have a state-of-the-art room in the hospital constructed and built, and has been lying idle since 2018, but has not got the funding to put the equipment in so that we can fully utilise our two theatres at Roscommon University Hospital. And while some parts of the country are struggling in terms of staffing, we actually have the staff to run our theatres, but we don't have the sterilisation equipment to ensure that we can actually maximise the throughput of patients. And we have patients right across the west of Ireland, patients right across the middle of this country who are waiting in pain on waiting lists, who are waiting, sadly, sometimes to go through private hospitals, through the National Treatment Purchase Fund, to access treatment that could easily be available at Roscommon University Hospital if the funding was put in to provide the sterilisation facility there. And I'll read the headline from the local paper of the 25th of October 2018. New CSSD unit for Roscommon Hospital confirmed. And that was on foot of the commitment that I got from Minister Simon Harris at the time. And that Roscommon Hospital has now got the agreement between HSE Estates and the hospital group to proceed with it, as I say, on foot of that engagement. The then local senator, now the Aristot in the Department of Health, Senator Frank Feehan, now Minister Feehan said, based on my discussions with Minister Harris, I'm confident this project brief will be progressed to design stage as quickly as possible next year. He went on to point out that I've repeatedly highlighted the need to put a long-term solution in place. Absolutely nothing has happened since that. The brief was done. The brief was presented to the steering group on the 13th of November 2019, and there it has sat since. On the 15th of September of 2020, the Minister Donnelly told me in a parliamentary reply that further information is currently being collated in order to future-proof the decontamination requirements for the whole Celta Hospital Group. And that had been going on for 12 months at that stage. And the Minister went on to tell me, I'm advised that by the HSE that this exercise will be completed by the fourth quarter of 2020. Yet, I've been told in a recent parliamentary reply, that's exactly where this project is at today. 3 years we're waiting for the navel gazing to take place because the Sálta Hospital Group and HSE Estates are determined not to fit out a state-of-the-art building. And I'll tell you, Minister, what's in that building today. I know Minister Donnelly was in Roscommon Hospital recently, and he visited the new endoscopic facilities there. And he passed by the door of the CSSD. And inside there today are walking frames, crutches, beds and wheelchairs, because it's now being used as a storage facility. Something that could actually be used to actually provide treatment to people that are waiting in pain, and instead of that, they will eventually, through the National Treatment Purchase Fund, access that treatment in private hospitals. But it's just not good enough for the sake of a small amount of capital funding that we can't fit out a building that is there already, and it is disappointing. As you know, Minister, I have tabled an amendment to committee stage, and we'll deal with this tomorrow. I'm not sure whether it will be you or some of the other ministers that will be dealing with it, but we'll deal with it tomorrow. But the reason that I'm questioning the commitment in relation to Roscommon Hospital, because there is a lack of commitment generally within our health service to our smaller hospitals. And the difficulty is that, in the main, consultants don't like travelling from the regional centres to these smaller hospitals where there is capacity, where patients can be treated, and where we can address some of the monumental backlogs and waiting lists that we have at the moment. But if consultants don't travel, it doesn't happen. And I can give you practical examples, because what has happened in Roscommon, and yes, the Taoiseach is right that services have increased there, that we actually have, thankfully, a problem with car parking at Roscommon Hospital. But that's because we have had two very progressive consultants who happen to come from County Roscommon, who have dramatically expanded the services there and provided services that are the envy of any other hospital in the country in terms of urology and in terms of plastics. But why is it that we have to rely on our own native consultants to provide those services? Why are we not seeing other consultants within the Sálta Hospital Group providing services? In a hospital group which was the first hospital group established in the country, which had claimed that it was committed to expanding the services in the level 2 hospitals. And that is not happening. And we will see tomorrow, in terms of my amendment, the exact same thing happening in terms of health insurance. This will be, I think, the 4th year in a row that I will be raising this specific issue in terms of the smaller hospitals not being covered by Irish life health insurance. It specifically has discriminated against these smaller hospitals that could help to ease some of the pressure on the bigger hospitals across the country. And in fairness to Minister Harris, back in 2019, he did give a commitment to look at it. However, Minister Donnelly, in a recent reply to me, has said, no, we're not going to do that. Sláinte Care now is being implemented. It's about taking the private health insurers out of our public hospitals, and we're going to use the smaller hospitals as the guinea pig in relation to that. Now, surely, Minister, if we want to use anywhere as a guinea pig, it would be the major hospitals you would start with, where there's huge pressure on hospital beds, where there's huge pressure on waiting lists. But of course, Minister, that would have an impact in terms of the consultants there. The same consultants that won't travel to the smaller hospitals. And of course, they don't want to see their income being impacted in the regional centres. So that's why the smaller hospitals aren't being protected by the government in terms of the decision being taken by Irish Life Health. Two final points, Minister, that I want to raise, and that is I want to echo the comments by colleagues earlier, particularly Deputy Roisin Shortall, in terms of Sláinte Care. It is vitally imperative that we do drive forward with the reform of Sláinte Care. But that doesn't mean, Minister, that we should be using the small hospitals as the guinea pigs for it, when clearly we're not prepared to put the capital investment in to actually deal with it, as I've given you in relation to the example regarding Roscommon. So don't come and spin this yarn to me that, well, the reason that we're not putting the thumbscrews on Irish Life Health is because we want to use the smaller hospitals to drive forward the Sláinte Care reforms. If that's the case, then you'll be putting the capital investment into the smaller hospitals, which isn't happening. But I do want to see Sláinte Care happen. I think we do need to see a single unified health system in this country. And that's why, along with Deputy Harty, I insisted during the negotiations on the programme for government in 2016 that there would be an all-party committee established to actually look at this and to set down a long-term plan for our health system. Because I had seen in the previous 15 years that I've been in politics that it all depended on the minister that was in the chair and behind the desk on a particular day. And as soon as that minister left, you had the permanent government reverting back to form, and the new minister came in and had to start that battle again. So it was important that you had consistency across government and political parties, and I think it is imperative that we do see, despite the pushback from the permanent government, that we do see the Parliament, the parliamentarians and the politicians taking ownership of Sláinte Care and driving it through. The final point that I want to make, and that is that, as you know, this legislation, which will bring about a reduction in terms of the cost of insurance, will only kick in April, after the bulk of people have already renewed their health insurance. And can I actively encourage every single person who gets a renewal of their policy, would they please, please, please shop around, because they will make significant savings. And there are a number of companies out there now that specialise in that. And I would actively encourage them to go to those companies and shop around and make those savings, because that in itself will drive some of the change that's needed. Gormago.